All right, welcome everybody. This is a golf prevention and treatment of golf-related shoulder injuries, and my name is Robert McCabe. I'm going to be providing this webinar. So we're going to talk about the shoulder anatomy, the prevalence of injuries, and then go through some common rehab and prevention exercises. A lot of these you can do really in the comfort of your own home, some of these basic golf prevention exercises. So 1 second here. Okay. So when we look at the with shoulder, the rotator cuff, as we're going to talk about, is one of the most common injuries in golfers. And this is real quickly, we'll just talk about the rotator cuff. Here is the excuse me, here is the rotator cuff, and you can see that it's made up of 4 tendons shown here. And really it's a group of tendons that help control the shoulder. And they're very small tendons. They can get injured from the golf swing if done repetitively over time. Since a lot of golfers are many golfers, I should say, are in middle age to older age category, these tendons naturally get a little bit weaker over time. So if you put a lot of loading on those tendons, they can start to break down a little bit. And then we'll go to the next injury, which we sometimes will see is the bursitis. So bursitis and tendonitis are very similar. The tendon is right next to the bursa, so the bursa can get inflamed, and often you see both of these together, rotator cuff, tendonitis, inflammation of the tendon, and then also where you can have inflammation of the bursa, and the tendonitis will cause the bursitis in most cases. Then also another injury or even just a condition is arthritis. And you can have this arthritis throughout your whole life, and then you pick up golf, and then it's maybe just a little bit of stress on the shoulder that can accentuate the pain due to the arthritis. And the arthritis can be in the deep in the shoulder joint. Like if you look at this picture of the ball and socket joint, if you imagine that as a ball and socket, and then if you look above that, there's another joint at your collarbone. So if you put your hands on your collarbone and you go out to the end of your collarbone, there is a joint there, and that joint is definitely under quite a bit of stress with the golf swing, and you can get some arthritis right in that small joint there. So that is another type of shoulder condition that you can have. The shoulder blade is important in that it really, the muscles around your shoulder blade area are really the foundation for your rotator cuff muscles. So these kind of provide a stable base for those smaller muscles to work off of. And so many in rehab and injury prevention, some of the exercises are to target that area of the upper back. And by the way, poor posture over time can lead to weakness of these muscles. And in the golf position, you're in that kind of forward posture position quite a bit. Especially if you play golf a lot, several times a week, you tend to be in that athletic stance, forward head, forward shoulder posture. So it's real important to strengthen these muscles, because golf can actually lead to a little bit of that forward shoulder posture, especially if you play a lot. And with the shoulder, in terms of where it ranks with shoulder, with golf injuries, low back pain is #1 on the list for golfers. So the lower back sprains and strains are common. And then probably the elbow, otherwise known as golfer's elbow, you've probably heard of. It's a tendonitis in the elbow, and it can occur, it can happen on either the inside or the outside tendon of your elbow. And then the shoulder injury. Shoulder injuries would come in pretty high, the third most common injury. And yeah, we just already talked a little bit about this, but rotator cuff tendonitis, perhaps some tears, small tears typically with tendonitis occur. And then bursitis, as we mentioned. Another tendon we didn't talk about is the biceps, right near the rotator cuff. There's a biceps tendon that can become inflamed as well. We talked about the AC joint arthritis, and then there's also general joint arthritis. And then I didn't show labral tears, but that's a cartilage type of injury in the shoulder. Probably not as well, definitely not as common as rotator cuff, but you still do see labral injuries, which is like a cartilage injury in golfers. And when you look at golf, when you really look at golf, you know, the key performance factors are, well, first of all, technique. But if you don't have the physical requirements to play golf, the basic performance factors, then you could have the, you know, good technique, but still be setting yourself up for injury. And even your performance can be affected if you don't have mobility in the spine, the shoulder, and the hip. Those three areas probably, in terms of mobility, they feed off of each other. So in other words, if you're lacking hip mobility, then you can put extra stress on the shoulder, and the same with spine mobility. If you're stiff in the spine area, then your shoulder is going to take a little bit more stress. So mobility is very important. Flexibility. We're going to talk about some exercises. So this whole thing is called like the kinetic. You know, they call it the kinetic chain type of theory, I guess. If you have a weakness in anywhere along the chain, somewhere else along the line is going to pick up the stress. But mobility is not the only thing. You need strength and stability as well. So again, shoulder, spine, and hip. Those are the key areas for stability as well as range of motion. I am by no means a golfing pro. My golf game has a lot to be desired. You know, but I would say that you know, I can get the ball down the fairway just because I have at least basic performance factors. So one thing, if you look at the golf swing, the proper golf swing, and I'm oversimplifying this, but it begins with rotation, or actually, I shouldn't say the hips, the lower spine rotation, and then eventually the shoulder rotation. So there's a couple of ways you can tell if you have these performance factors. Real quickly, I'm going to show like a 2-minute self-assessment, and you can do some of these tests at your house or in, you know, wherever you are at home. And so one of the mobility exercises or tests is to basically stand up against the wall. And this is looking at your spine mobility. We call it thoracic mobility, but it's essentially your flexibility of your chest. Remember, we said if you're in that forward shoulder posture, you can get these muscles in the front here can get tight. So this is a test for chest wall mobility and even spine mobility. So you're going to stand like about, if you notice, about 4 inches away from the wall with the heels. You put your hand, your back is going to be against the wall, and then you just try to flip those arms backwards and see if your forearms can lay flat against the wall. If they can't, then you have some tightness either in spine in the back or even in the chest in the front. So that's a simple test you can do. And we'll talk about some, well, actually, I'll bring it up now. If you do have, tightness, then this is a good exercise to actually do until you can get those forearms to touch the wall. So this is an assessment, but also a good exercise if you don't pass that test. This is another one. You need like a dowel or a stick. You can even use your golf club, and you're going to kind of put it across your shoulders and sit in a chair and kind of cross your arms. And you're going to rotate. You're going to try to turn your torso, and you want to get your elbow to be able to go outside of your knee. And you can see on this, I'm barely making it, but on the other side, the video got cut off a little bit, but I was not able to get my right elbow to my left knee. So I'm lacking rotation in one direction. Again, this is a good exercise to do if you find that you're not able to get your elbow to the outside of your knee. So that's really looking at your spine mobility. This is probably even more relevant for golf than the previous test because this is pure rotation, which you need in the golf swing. Now, looking at your shoulder flexibility, there's a simple test you can do. You stand up and you're going to have one arm go over the back, one arm go under, and you take your thumbs and you hold them in your fist. And you try to bring your hands close together. You should be able to get within about the width of your fist. And you can see my coworker here, he's got some work to do on his flexibility. He's probably about 3 feet away in terms of touching his fist. So you want to be much closer than that. And then you would also do the opposite of that and test the other direction. But that's a good quick assessment on shoulder mobility. Now for the hip, the basic one you can do for the hip mobility is just simply cross your ankle over your knee, just as if you were putting a pair of socks on. If you have a difficult time doing that, that definitely indicates a lack of hip rotation mobility. So ideally, you would even be able to press that knee down so that the knee is almost, at the same level as the foot. So anyways, so that's for hip mobility. I'll just show that one more time. Cross your leg over, and at least that's the bare minimum, but your knee, you'd want your knee to be resting a little bit lower than this, almost parallel to the floor. So here are a couple exercises that we're going to show for the shoulder. So if we find that you don't pass that shoulder test, here's a simple drill you can do using the golf club. You put it behind your back. We're going to do each arm separately. We first start with the left arm behind the back, and you're just going to pull your arm up by pulling through the golf club, or you can use a stick or a broom handle or anything that works. And we're going to have basically do that about 10 to 15 times. You're going to pull the arm up nice and easy and then let it slide back down. And you would do that on both sides. So that's for the shoulder mobility. And then we didn't talk about strength. Now, it is really hard to test your own strength. I mean, the mobility exercises you can do pretty easily at home, those 3 mobility tests. And by the way, just so in case I probably forgot this, but going back to that hip test, it goes without saying the best stretch for this, if you lack rotation, is actually to work on this. So you put your leg in what we call the figure 4 position, and you can stretch your hip. I will say it's a little bit easier to do this if you lie on your back back. So if you're really struggling with this, on the floor or on the bed, and do the exact same stretch. As you lay down on your back, your muscles just kind of ease up a little bit, as opposed to sitting in the chair, and it's a little bit easier to stretch when you're lying back. So I would recommend doing this as a stretch, but from your back. Now we're going to get into a little strengthening, but strengthening is kind of hard to test on yourself. It's really hard for you to go home and say, okay, I'm going to test my shoulder strength. But these are typical exercises that we give a lot of golfers, especially those that have rotator cuff issues. But these are good prevention exercises for getting an injury in the first place, particular to the rotator cuff muscles, rotator cuff tendons, which is, again, very common. So if you just have some band at home, you tie the TheraBand to a door. You can go on Amazon and buy TheraBand, elastic band for a very affordable price. It's probably under $10, or you can go to sporting goods store and pick up some tubing like this. And that's one drill that we do here, and that's called internal rotation. Then the other one we're going to show is just the opposite of that. These are external rotation, and these are exercises that we would give somebody if they had an injury to the rotator cuff at the appropriate time, assuming they didn't have pain with these exercises. But these are good injury prevention exercises. Very important, though, that you don't have shoulder pain with these exercises. If you do, then you should not work through that. You would want to consult. I would recommend going to the orthopedist and getting an appointment. Have your shoulder looked at if these are causing you any pain at all. This is shoulder flexion with dumbbells. So really, you don't need a lot of weight. We're talking probably like 2 or 3 pounds. And this is a good exercise, just lifting them in front, stopping at about shoulder height. And then we do what are called the V lifts, which are really the same thing, except you're going to kind of put your arms at about like a 45-degree angle and lift, again, very light weights, 2 pounds, maybe 3 pounds, going up to about shoulder height. And then the last one we do is for the shoulder. Oops. It's actually 2 more. Oh, maybe that is, here we go. So that's going out to the side. So the front and the diagonals, and then out to the side. On all these, you want to keep your thumbs pointing up to the ceiling. And then here's a simple one you can do with the band. This is a good posture exercise. You're just pulling the band apart, and we do this diagonally as well as with the arms straight out. So that is good for strengthening out both shoulders there. And then this is a very good one for posture as well. Simple rowing motion with the band. If you have a 2-handled TheraBand, you can do this. If you only have a single band, you can do 1 arm at a time. But the idea is to pull in and really expand your chest and squeeze your shoulder blades together. Very good exercise for strengthening the upper back area that we talked about. Again, this is good for preventing more or less shoulder injuries. Now, this is also another exercise. If you don't have that mobility in your spine, your shoulder takes more stress. So this is a very simple exercise you can do at home to work on that rotational movement. And this is a trunk rotation. So you just lie down almost in the fetal position, and you're going to keep your knees together, and then you take your arm, bring it back. Notice the head is following, trying to look at your hand the whole time that you rotate. And that would be both directions. You'd want to lay on the other side and do about 10 to 15 of these. In general, 10 to 15 is more than enough. And with those shoulder exercises, about 2 to 3 sets of 10 is with the bands are more than enough. And just a couple of tips prior to playing. It's good to do a warm up, and a good warm up is just walking. That warms up all the muscles, including the trunk muscles, the hip muscles. We call that an active warm up. So it actually increases blood flow, and that's a good thing to do for 5 to 10 minutes before you play golf. Because when you go out and swing with a maximal effort, and if those muscles are not warmed up, you're going to have a higher chance at causing a small tear or a sprain, not just the shoulder, but lower back sprains, things like that. So we definitely recommend a warm up. And ideally, you do some of those exercises that we showed before, like the trunk rotation lying on the side, and some of the shoulder mobility and the hip mobility drills before you play. But if nothing else, if you can at least just do a few rotational warm-ups with your golf club, simply doing 10 or 20 of these really does loosen up the trunk a little bit before you play. So just 10 or 20 of these rotation, you can use your golf club, and you're going to bend forward while you rotate, work on that spine rotation. And even afterwards, stretching and doing the mobility afterwards is actually a good idea, because what happens when you play golf or you do any sport or activity, the muscles will tighten up, and then that's the best time to stretch them out, is actually also after a round of golf. I'm kind of going all over the place, sorry about that, but here's another. This is what I was referring to before about the hip stretch. So you just lie on your back, and you're going to cross your leg over and push down on your knee. And that's an excellent, we call it the figure 4 stretch, or the hip stretch. And most people can do this, even if they are tight in their hips. Easier to do this lying on your back than sitting down. And then I think this is the last exercise. Real important one though. This stretches out the front of your hip. So you can use something to hold on to, like a stick, or you can put your hand on a countertop, or even at the stairwell. If you have stairs in your house, but you put your foot up on like the 3rd or 4th step, and you lean into it, and you hold it for about 20-30 seconds. So that's a general rule with all the stretches, is to hold it about 20-30 seconds, do 2 or 3 times, and then you want to switch legs. And this is a good exercise for the hip, and also helping to improve posture as well. Because when these are tight, it kind of pulls you forward, puts a strain on your back, and even indirectly can strain your shoulder. So we're going to show, we have time to just kind of go through a few common questions, and then I definitely would be interested in answering any questions that you have after that. Some of the common questions that we have is, should I use ice or heat after? If I have shoulder pain, should I use ice or heat, let's say after playing golf? I recommend ice, especially if there's any discomfort in the shoulder. Perhaps you have a tendonitis brewing. You might have a little bit of overuse of the shoulder, and really it's hard to go wrong with ice. Heat, on the other hand, can sometimes make things a little bit worse, especially if you have an inflammation. And then, so in general, I'd say ice afterwards versus heat. Is it really that important to warm up? It really is, because, and I think sometimes people think a warm up is stretching. And although stretching and mobility is important, it's probably actually maybe not even as important as the warm up. So the warm up, again, is some kind of activity. Could be riding a stationary bike, could be walking, could be doing a rowing machine, but you're actually getting blood flow and you're warming up the tissue. So that's important, not just stretching. Stretching, on the other hand, is you're not warming up the muscle. You may stretch it and elongate it, But if that muscle's not warmed up, it's still not going to be as elastic, as it could be if you warm it up. So they're both important, and really, it doesn't matter what order you do them in, but both really should be done prior to playing golf, especially on a cold day where your muscles are not, you know, they're not going to elongate as easily. Should I stretch before and after playing golf? Absolutely. Both are important. You could make a case that it's just as important to stretch afterwards, because if you keep, the muscles get a little tighter. And then over time, if you walk away without stretching, and we know stretching is not fun, it's not as fun as playing golf, but even if you can just do a couple minutes of stretching, you can probably prolong your golf career by minimizing your injuries. What can happen if I continue to play golf with shoulder pain? And really, this applies to any injury. You can make it worse, whether it's a simple sprain, a mild tendonitis, that can relatively, pretty easily go on to become a more severe tendonitis and perhaps even a tear. So really, it's best to, if you have pain for more than 2 or 3 days, I recommend going to an orthopedic surgeon, and that's really the safest way to get it managed. And then perhaps you need physical therapy, whatever the surgeon recommends, they can direct you to the proper treatment. And so those are some of the basic common questions. So yeah, I just want to finish with that, and if anybody has any questions, I'll be glad to answer those at this time. Let's see where we are.
Bob, one of the questions was, are we seeing patients 5 days a week here in the Market Commons office?
One of the questions that came in is, are we seeing patients at the marketplace, at the Market Commons office? And yes, at OrthoSC, we're seeing patients Monday through Friday. And that's for, again, for orthopedic consultations, physical therapy, and services as well. So both the orthopedic surgeons as well as the physical therapists. Any other questions?
The other question is it easy to get in? Is it easy to get an appointment here at the Market Commons office?
And another question that just came in, is it easy to get an appointment at the Market Commons, office? Did that twice, but yes, it is. We get patients in quickly and as fast as possible, but currently, yes, you can get in almost immediately with your physical injury or your shoulder injury.
Okay, it looks like there's another question that's come up.
And there's another question. So this is from Richard. I believe I have AC joint arthritis, and how successful is PT along with all the stretching and exercises to get me back to at least 80% prior to my injury? The AC joint, it depends on the severity, of course, like everything, but in general, these injuries are managed pretty well without anything, really too invasive, such as surgery. So therapy is successful for these, and the focus is really just on mobilizing the AC joint. It often is stiff, and then strengthening around the joint. Some people may benefit from an injection, but that's really an orthopedic surgeon's call. But that can be complementary to therapy. And the other thing is if it's on the left side, that's for a right-handed golfer, that takes a lot of stress. So it might take a little bit longer if it's a left-handed or left-sided AC joint, but overall they do very well.
Okay, another question is, Hold on, Bob. Does OrthoSC have a library of videos that I can go and watch at any time? And when will this video be available to view?
So this is another question came in. Does OrthoSC have a library of videos that we can refer to, including the ones that we just provided in this webinar? So this will be uploaded, I believe, this week. And so if you didn't get a chance to remember those exercise videos, and why would you? I mean, we just showed them real quick. You can go on there and quickly review those videos. They'll be on the OrthoSC website. Just go to www.orthosc.org or .org, yes.
You can also from there go directly to patient resources into the library, and you can view any of those videos at any time. Bob, that looks like that's all the questions. Any other questions?
Okay, no other questions. So thank you for tuning in and good luck on the golf course.